Korea's healthcare system and the low birth rate crisis. Last month, the Yoon administration announced changes in policies across four areas: healthcare, welfare, education, and labor. All that as Korea finds itself at a critical juncture. On one hand, its healthcare system is straining under the weight of step-mother shortages, and on the other, its birth rate continued to be alarmingly low. Should I applaud an increase in medical school quotas and the provision of more family support? I guess that yes, but that's just the beginning as they fail to address the larger, interconnected social issues. What to do? Brace for two terms: integrated and comprehensive, not just isolated reforms. If the government uses a multi-sectoral approach that integrates several policies, rest assured it will provide better support for everyone sustainably. Yes, the government has introduced family-friendly policies, extended parental leave and child care subsidies, but these efforts won't be enough to reverse the trend. Don't pat yourself on the back for the last month's hiccup in numbers of newborns. The number is still very low on average. What's actually needed is comprehensive and harmonized family support extended to all children. If those benefits apply to only babies born from a certain date, parents of children born just a month earlier would feel left out and mistreated, as is the case now. 300,000 won to some and a million won to the latter. Open policies target the young who don't have children, but what about everyone else? With enough persuasion and support, those you already have a child or even two would be willing to give it another shot. Even before that, one major barrier to starting a family in Korea is financial insecurity. To overcome this, the government should introduce affordable housing schemes, not separate apartment complexes specifically designed for not only young families but a larger group of society. A subsidized home ownership or low interest loans to help ease the financial burden, paired with expansion in child care subsidies while introducing universal pre-kindergarten education. I repeat, universal, would further lighten the load. It is a dream for not only young families but all families. At the same time, Korea needed to create a work culture that supports parents, especially women, in balancing career and family responsibilities, not as it has been in the past 50 years. Do everything for your company, starting with the small and simple steps like the promoting flexible work arrangement, remote work, part-time employment, and flexible hours, and encouraging greater pat- paternal involvement through paid paternity leave and even shared parental leave policies would be a logical continuation of that. Unfortunately, public child care programs like the Nolbeum or doorbell have gotten a bad rap, with anyone subscribing to these classes being judged as someone who can't afford hagwons or private tutoring. In other words, policymakers very often have way too little understanding of the real-life outcomes when their proposals are applied. Expensive private tutoring and intense academic competition have created an artificial social ladder and behind it a huge shadow industry. We must dismantle it. This rat chase puts an enormous financial and emotional strain on families, making it harder for any couple to consider having more children. The solution is pretty simple. Introduce diversity into the quality public education system by rendering private education less relevant. Instead of relying on a single high-stake exam, we needed to create a multitude of career pathways for students' future prosperity. The list can go on and on, like investing in after-school programs and extracurricular activities that would allow students to pursue their interest, and they should also be much better than any hagwon or private tutor, not just the SKY, as our goal, but sky is not the limit, should be our slogan in education. All that should come in parallel with the changes in health insurance, another critical component of support for families. Seemingly comprehensive, many families still face significant out-of-pocket expenses for services such as prenatal care, fertility treatments, pediatric care, and especially the infamously expensive postnatal care. Recently introduced changes to the healthcare system, in fact, did quite the opposite. Prices actually went up. If parents go to a doctor with a sick child today, they will have to shell out around double what it used to be just a few months ago. And on holidays and weekends, they pay roughly triple. No parent wants their child to get sick, but if they do, everything goes up. Stress, time spent with the sick child, food expenses, health insurance coverage must counter these emergencies. Extended preventive care, routine checkups, vaccination, and mental health support would not only improve long-term health for both the parents and the children, but also reduce the need for more expensive intervention later. Speaking of older adults, the social welfare reform program also needed to see that Korea's aging population does not overwhelm an already strained health care system. Non-predatory long-term care insurance, and especially investment in community-based care models, where older adults would receive care in their homes or even better in local communal centers, equipped with telemedicine and artificial intelligence-driven diagnostic tools, would not only reduce the strain on hospitals but also make them feel less lonely by giving them more personalized care. That brings me to the last component, that I was trying hard to find in the government announcement, but couldn't. The philosophy of the proposed policies. It is the simple folk, parents, students, and the people like you and me who should be the motivation for any change at the center of any policy, not grand slogans, personal pride, or organizational interest and benefit. However, the government's proposed solution, essentially throwing more money at it, aren't really working. Korea's healthcare system and the troubled approach to it are creating a much bigger problem down the road. I wonder what waits for us 5 years later. My fear is that the policies today are creating a class of selected doctors running an unpredictable system, very much like one in the US. Any philosophy won't come before there is trust between healthcare professionals and the government. I could suggest a collaborative governance model where doctors, nurses, and hospital administrators would have a seat at the policy-making table, the one that could ensure that future reforms are both practical and widely supported. But that will never happen unless the administration take a proper, mature, and serious stance.